Okay, so today I'm going to talk to y'all about what a stroke is, how it affects different people, and how advances in technology allow occupational therapists to rehabilitate the victims of strokes. A stroke is caused when blood flow is cut off to the brain and it deprives the brain of the oxygen that it needs to function. Every 40 seconds in America, somebody has a stroke, and every 4 minutes, someone dies from a stroke. Strokes are the 5th leading cause of death in America and the #1 cause of disability in America. It limits your mobility and what you can do with your arms and your legs, and sometimes even the side of your face. Each year, strokes affect different people of all ages, and most require some form of rehabilitation to gain full mobility again. Most people that have one stroke normally have one to follow in a few years, and it's normally worse than the first one was. Due to advances in technology, occupational therapists are able to do rehabilitation with stroke victims, and they help them regain their mobility back and do the daily tasks that they weren't able to after their stroke occurred. Since I'm not an expert on the subject, I did extensive research and found all my facts online. I checked with the American Heart Association, the National American Occupational Therapy Association, and the National Stroke Association. Although strokes mostly occur in the same way, there's different types, and they all are caused by different things. An ischemic stroke is the result of obstruction to a blood vessel connecting to the brain. The underlying causes of this is fatty acids building up in the vessels, and then it blocks the oxygen that the brain needs to keep functioning. Hemorrhagic strokes are caused by ruptured blood vessels that cause brain bleeding. And transition ischemic attacks are mini strokes that are caused by a temporary blood clot, and their effects normally aren't as severe as the other two. Different types of strokes have different effects on each individual, but the main effects are normally the same. Strokes affect either the left brain or the right brain, and depending on which side they affect is what side of the body it affects. Strokes can cause, if it affects your left brain, it can cause the left side of your face to droop, or your left arm or your left leg to lose mobility. And if it affects the right side of your brain, it can cause the right side of your face to droop and your arm and your leg not to work. They also cause cognitive problems such as hearing loss, attention deficit, memory loss, thinking, and attention problems. Most stroke patients don't learn as quickly as they did before the stroke, and they do things slower normally than before. Recently, to improve technology has recently improved the way that occupational therapists do rehabilitation for their patients. When the Nintendo Wii came out, because therapy for stroke patients is so expensive and a lot of people can't afford it, they learned that they can use the Wii Fit and Wii Motion to help the patients regain feeling back in their arms and their legs, and it teaches them slowly but in a fun way and in a totally inexpensive way how they can start to use their arms and their legs again and eventually go back to doing the things that they were before. Victims from stroke also suffer from loss of speaking, and they normally can't speak as well as they did because it affects their mouth. And there's a new technology, it's a computer program, and you can download it and you take it with you when you go, so it's like on your phone. And if you talk into it, it guesses what you're trying to say, because when you have a stroke, it's very frustrating that you can't get out what you want to say. And so this guesses it for you, and it makes it easier for the people around you to talk to you. Also, computer programs have been created to help the patients read out loud, which helps with their speaking, and the more that they read, the more that they're able to talk and to learn how to use their voices again. In conclusion, strokes are not the best thing. They affect all of your body and not just you, the people around you. They cause problems in your whole body, and they can be very frustrating for a patient. They're very common. Most of us probably know someone that's had a stroke, but thankfully, due to technology, the stroke patients can be helped, and the stroke patients can be helped by therapy. Some inexpensive, some expensive, but thanks to technology, we're able to help these patients.
Oh, sorry.